better outcome. So I'm hoping today we can take something positive from it. So what I'm going to do is I'm going to share my screen. Hopefully this will work.
You should be able to.
Yeah, that should be okay. So can everyone see that okay?
Yes, thank you.
Brilliant. Okay. So I am going to aim to get this all, I want to get through this so that we've definitely got time at the end to have questions, but also just a discussion. If people want this space to just chat about things and seeing, I'd be really interested in hearing what people have to say. So, you use the space as how you'd like to. So as Caroline was saying, tonight is just about an introduction to eating disorders. It obviously is a huge topic, and what we're going to try and do is just focus on, giving you an intro, really. I just wanted to show you this, really, because really, as Caroline and Joe were just saying just now, there has been increasing attention on eating disorders more recently. And there's been lots of news articles. And this is an article that was in the BBC News at the end of December, which was just, an article about the sharp rise in eating disorders. And we have seen a really significant increase in eating disorder referrals, particularly in the last 12 months. So, and it does coincide with the pandemic and lockdown. And some eating disorder services are seeing, that referral rates are at least tripling in the last 12 months. So it's a really, really big increase. Lots of reasons why that would be, but really, I suppose it's, not being able to go to school, not seeing friends, not being able to do all those extracurricular activities that people want to do, exams being cancelled, all these things where life's feeling a little bit out of control. The knock-on effect is, it means that they're trying to control other areas of their life. So tonight, well, Caroline's done the lovely welcome, so we've done that. What I'd like to, focus on really are what are eating disorders. Talk a little bit about statistics, including prevalence. Talk a little bit about eating disorders in sport, and then towards the end, what I'd like to focus on is what are the signs to look out for, and what can you do, and then we can have questions at the end. So we are going to be looking at the first 4 of these eating disorders here. So anorexia, bulimia, binge eating disorder, and OSFED, which I put that because it's really long, it's a bit wordy. So that stands for otherwise specified feeding and eating disorder. So they're the 4 that I'm going to focus on. I've put ARFID down there. I'm actually not going to be talking about ARFID. ARFID stands for Avoidant Restrictive Food Intake Disorder. It does come under feeding and eating disorders, but unlike the other diagnoses that we can see here, it's not about concern with body, sort of body shape and weight. And that's really what I want to focus on tonight. So I put it there because on one of the slides, you'll see it in the, we're looking at prevalence, but that's not what I'm going to be talking about tonight. So we'll start with anorexia. So lots of people have heard about anorexia. And to have a diagnosis for anorexia, you have to meet 3 criteria. So the first is a significantly low body weight, and that's due to restricted eating, or it's a failure to gain weight that would be expected for your age, sex, and height. So by significantly low body weight, we're talking about below 85% of your expected body weight, or a BMI of 17.5 or lower. Now, for anyone who doesn't know what BMI is, it stands for body mass index. And the way they calculate it is that it's a person's weight in kilograms divided by the square of their height in meters. So basically, the bigger the BMI, the heavier you are. In young people below the age of 18, we tend to use weight for height percentage rather than BMI, and that's because it takes into account your age and your gender. So 100% weight for height is the median BMI for other people of your age and gender. So in clinics, we would be thinking anything above 95% is sort of like a healthy weight for height. It just gives a guide. So I think we know it's not a one-size-fits-all approach, and we know that we need to take into account individual differences when we're looking at weight. And everyone's different. So some people are naturally smaller, some people are naturally bigger, but it's useful as a guide. So yeah, there are 3 criteria you have to fulfill to meet for a diagnosis. So the first is significantly low body weight. The second is an intense fear of becoming fat and gaining weight. So that means that somebody will be doing lots of things to try and lose weight or to prevent weight gain, even if they're really underweight. So that's eating very little, only eating very low calorie foods, exercising compulsively. The third criteria is a distorted body image and abnormal attitudes to food and weight. So someone with anorexia is going to think they look big, fat, overweight, even though they're significantly underweight. It's important to say this is different from normal feelings of being dissatisfied with our bodies, because it's normal in today's times that actually people often dislike their bodies. Lots of teenagers feel self-conscious about their appearance, and they say they want to change aspects of how they look, or they want to lose weight. In anorexia, this is really extreme, and it means that they're unable to see how serious the problem is, and they're unable to see that the way they're trying to lose weight is really putting their health at risk. There are 2 subtypes. I just put that because sometimes we hear about that. There's restricting and binge purge. So restricting means where somebody's only restricting, and binge purge is when they got in a cycle of either restricting but also binging and then trying to get rid of the food, and that might be through, you know, vomiting or using laxatives, that type of thing. Right, so next one we're going to talk about is bulimia. So again, you have to meet 3 criteria for a diagnosis of bulimia. The first is binge eating excessive amounts of food. And when I say excessive amounts of food, I mean really large amounts of food eaten in a short period of time, and an amount that's much, much larger than most people would or could eat in that time. But along with that, there's this overwhelming sense of lack of control. So somebody would say that they literally feel they couldn't stop, that they're not in control of it at all. And somebody would even say it's like they're in a trance, that they're not even aware of what they've eaten. The second criteria would be extreme concern about body shape and weight. And the third is that they are doing what I call compensatory behaviours to prevent weight gain. So most people will associate bulimia with eating and then making themselves sick. But you don't actually have to be making yourself sick to meet criteria for bulimia. So it can be that you're actually misusing laxatives, or you're doing really excessive amounts of exercise. So it's anything that you're doing to try and prevent weight gain. But for bulimia, you have to be doing these behaviours at least once a week for 3 months. So binge eating disorder, again, like bulimia, there's the binge eating excessive amounts of food and that feeling of loss of control. And there's significant distress, so that people would say they feel really upset, really guilty following binge eating episodes. But unlike bulimia, there aren't any compensatory behaviours. So that means that typically weight will be within the healthy, but often the overweight range. So OSFED. So this is the otherwise specified feeding and eating disorder. And this is basically the diagnosis for somebody when they don't meet full criteria for the other eating disorders. So there's still that extreme concern about weight and shape. Surprisingly to many, it is the most commonly diagnosed eating disorder. But the most important thing I'd want to say is that it's no less serious than the other eating disorders. So 2 diagnoses that you often see that would fall under OSFED would be atypical anorexia and atypical bulimia. So atypical anorexia would be when somebody meets most of, but not all, the criteria for anorexia. So that might be somebody who they meet all the criteria, but their weight is actually is above that 85% cutoff. So they might even be within the normal range. And interestingly, it's actually, we've seen a really significant increase over the last year since the pandemic in atypical anorexia cases. So somebody might be in the normal range in terms of weight, but they're still extremely concerned about their weight. They're really anxious about gaining weight. They want to lose weight, and they're still actively trying to lose weight. You could also have somebody who would meet criteria for atypical anorexia if they're actually very low in weight and they're restricting, but they're denying any body image concerns, but their behaviour is really contradictory to that, and it just doesn't really make sense. So they might also meet criteria. Atypical bulimia, an example of that would be somebody who is binging and purging, but they might not be doing it as frequently as once a week. So they would also fall into that.
And Susie, I suppose in lockdown, sorry, just to quickly interrupt, it must be really frustrating for people in a way that they are under lock and key within a house in lockdown if they've got those feelings, but yet and especially if they can't control them, but they know that there are people around, you know, if it's a family situation, which must be exacerbating mental health issues.
Yeah, absolutely. And I think, like I said at the beginning, I think you're at home and everything else is feeling out of control. You can't do all those things that you'd normally want to do. And also, it's not just stress within your own life, but I've also come across families where there's lots of stress generally in the families, where maybe parents, their jobs are at risk, or they've been made redundant, or there's lots of other family stresses. And overall, it means everything's feeling a little bit out of control. And food and exercise and weight is something that people can control. And it's something, that's why I think we're seeing a particular increase in it right now. Anorexia athletica, I must admit, this isn't actually a diagnosis that I've seen used clinically, but I wanted to include it as you're more likely to see it amongst athletes. And obviously, you know, we are girls in sport. I'm really trying to sort of focus on sport as well. To be honest, in a clinical setting, it would fall under OSFED and would most likely be referred to as atypical anorexia. So basically, it looks the same as anorexia. You know, it has all the distorted body image, you know, restricting calories, excessive exercise. The only difference is the weight, that actually people might fall into what would be like the normal weight range, because there's a higher threshold for this to take into account that those athletes are probably going to have more muscles. So that's why there would be that higher threshold, but they still might not be having their periods. So I just wanted to talk about that, like, just briefly. The female athlete triad, I wanted to talk about that. It's not a diagnostic category, but it is something that we look out for in young female athletes who present with eating disorder symptoms, as it can pose, I suppose it can be a risk to long-term health. So it includes 3 different conditions, which you can see in this diagram. So there's disordered eating, there is osteoporosis, which is sort of, I suppose, really reduced bone mineral density, where your bones are becoming less dense, they're weaker, they're more brittle. And also irregular periods, or amenorrhea, which I'm going to refer to later, and amenorrhea just refers to loss of periods. So basically, each condition is linked. So the disordered eating means that they're not going to be getting the right nutrition, which can cause their periods to stop. This in turn leads to calcium and bone loss, and that means that, you know, young athletes are going to be at much greater risk of osteopenia, which is the precursor, what comes before osteoporosis. And that means obviously you're going to be at much greater risk of stress fractures. So each condition is actually a medical concern in its own right, but together they create a bigger health risk. And any female athlete is at risk, but teenage girls are most at risk, and that's because of puberty, of biological changes, and obviously it's such a key stage of physical growth and development. Orthorexia it's not a recognised clinical diagnosis, but it is a term that I hear. I don't know, other people might have heard it actually. I mean, I've heard it quite a lot, even amongst friends. And it does describe a symptom that we commonly see amongst those with anorexia, bulimia, and OSFED. And it's referring to this really unhealthy obsession with healthy, pure, clean eating. What foods are regarded as pure or impure vary from person to person. And it doesn't mean that anybody who tries to follow a healthy eating plan is suffering from orthorexia. Really, you have to see the other symptoms that we're about to talk about below. It's often a way of managing difficult feelings and to feel in control. But the obsession around clean eating, it doesn't have to be driven by sort of a distorted body image or body image concerns. It can be sort of separate to that. It can often begin as a healthy diet, but then what happens is it becomes really rigorous and really obsessive. So it means that somebody can become incredibly rigid around their eating, planning, everything, the whole day around what they're going to eat. There's lots of research, lots of time spent checking food labels, checking ingredients, reading articles, reading recipes, and often avoiding eating out because they're worried about what ingredients will be in the food and whether it's pure and whether it's clean. Understandably, it can often lead to social isolation because, you know, that they're sort of too anxious to eat out, you know, seeing friends is going to involve eating. And so it means they tend to withdraw a little bit. And it also can cause physical problems because it means that with clean eating, people are often trying to cut out like whole food groups and are missing out then on really important nutrients. And I know that yesterday that you had an evening on like nutrition. So we know how important nutrition is. So I'm always get really, really worried when I hear people talking about this real obsession with clean eating because often the foods that people with orthorexia will eat are often the really low calorie, bulky foods, which often make them feel really bloated. And can actually make them then think that they can't, you know, makes it harder for them to eat what they need to eat. So this slide gives an indication of how prevalent each of the eating disorders are. As you can see, disordered eating, that sort of widest green circle, is by far the most prevalent. Now, mildly disordered eating, it isn't an eating disorder, but it's important to put that because really what it's saying is disordered eating is sort of the norm. Most people, or lots and lots of people, are on a diet, and many people, not just teenagers, anyone, lots of people say that they're going on diets a lot of the time. What's really important to say is dieting doesn't cause eating disorders, but what we know is that 95% of those people who develop an eating disorder will start off on a diet. So for those people who are vulnerable, what the diet can do is basically hook them, and that's the point at which the eating disorder starts. So prevalence rates are quite difficult to gauge. So these figures are taken from a study that was done in 2017. But, and that suggested that anorexia accounts for 8% of cases, bulimia 19%, binge eating disorder is 22%, and OSFED is 47%. So this is just a few stats. It's always hard giving accurate prevalence rates because generally the statistics recorded are based on those who are receiving or seeking treatment. So there's lots of people who aren't seeking treatment. So you're always slightly wary of how accurate they are. Research suggests that between 1.25 and 3.4 million people in the UK are affected by an eating disorder. But according to the Department of Health, they think, you know, the prevalence rates might actually be as high as 4 million. So for anorexia, it affects 0.4% of adolescent girls, around 1.9% of adult women. It does also affect boys and men. Again, the prevalence rates vary. I've put 25% here. That's generally what we'd say, but actually it can be anywhere between 1 in 4 and 1 in 8 cases would be male. I think that what can be really scary is that has the highest mortality rate of any sort of psychiatric disorder. And that is because of the high risk that's associated with all the medical complications associated with being very, very low weight, as well as the increased risk of suicide. But it's always a very scary thing for anyone to read, that that's when you're listening to information about anorexia and generally eating disorders. But what we know is that early treatment leads to a better outcome. And generally with treatment, what we know is that 50% of people will recover completely, 30% improve, 20% will remain chronically ill. So for some, in terms of the sort of, I suppose, the less positive outcomes often are in people who have had it for much longer, and there would be other reasons why. But generally, I think what we have to hold on to is that 50% do recover and 30% do make improvements. When we think about bulimia, I think as many as 8% of women will have bulimia at some point in their life, but at any one time, we think that 1 to 2% of women aged 16 to 35 will have bulimia. The average age of onset is 18 to 19. So I think I just skipped that on the other one. So in anorexia, it's a slightly younger age of onset, it's about 16, 17. With bulimia, it's slightly older at 18 to 19. Now with anorexia, generally that's the age of onset. It can affect children as young as 5. That is rare, but we do very occasionally see, we obviously do see it in younger children, but the average age is 16 to 17, and it's slightly older for bulimia. And with bulimia, again, there are medical complications, and that's to do with the type of behaviours that they do, that I talked about, those compensatory behaviours. For OSFED, we think that affects 4.8% of adolescent girls and 4.6% of adult women. So, eating disorders and sport. Just as Joe was saying at the beginning in the intro, we know, I'm such a firm advocate of exercise, sport, and we understand the benefits of sport on mental health. I think there can be sometimes, in those who are vulnerable, there can sometimes be that toxic combination that if there's the pressure of competition, and by that I mean the pressure to win or improve performance or to keep up with teammates, or you're in a particular sport where there's a very much focus on body or shape or weight, in combination with a real cultural emphasis on being thin, that can lead to a toxic combination in those who are already vulnerable to developing an eating disorder. Again, prevalence rates are quite difficult to gauge, as there can be a bit of underreporting. The best estimates are that eating disorders are twice as prevalent amongst athletes. And there was a study of elite athletes which suggested that eating disorders were as high as 20% in elite female athletes. But again, it's always hard to give really accurate figures. When we're looking at risk factors, we know that female athletes competing in sports that promote leanness, like long distance running, or appearance, like ice skating, they're more at risk. Also, athletes who take part in individual sports or endurance sports, those people who have been training since childhood or very elite athletes are more at risk. And when we talked about what perhaps makes somebody a bit more vulnerable, there's lots and lots of things. And I haven't got time tonight to think about causes of eating disorders, but just to give an idea, things like, being sort of low self-esteem, general anxiety, performance anxiety, somebody who's very self-critical, sort of perfectionist traits, sort of obsessional traits, those types of things put somebody a little bit more at risk. So the high-risk sports where there might be a higher proportion of athletes with eating disorders would be these types of sports. So swimming, running, gymnastics, diving, wrestling, judo, rowing. So the next part that really I wanted to focus on, well, what are the signs to look out for? And when I was speaking to Caroline earlier on this week, I was really impressed to hear about all the different people that should be here tonight. So I know it's, parents, teachers, sports coaches, young people, young women, teenagers. So I think it's absolutely great that there's so many of you here and sort of listening to this. And what I'm trying to do is really focus on all the different things that you can be looking out for. But what I would say is really important to focus on is change. We're looking for changes. Changes can be sudden, they can be gradual, and they can affect many, many different aspects of somebody's life. With these slides, I'm generally referring to she and he, she and her, and that's because, this is we are girls in sport. But obviously, as I said in the earlier slides, I know it does affect boys and men as well. So I certainly do aware of that. But just for tonight, I'm probably going to be using she and her a little bit more. So we're talking first of all about physical health signs. Now, some of these, again, I don't want this to sound too morbid. Some of these sound really quite scary. And we're not just looking at one individual symptom. With all of these things, it's trying to give you a gist of all these things you might be looking out for. So just one of these symptoms on their own is unlikely to be something, it's just meaning it's an eating disorder. We're trying to look at across the board. Looking at the bigger picture, not just one individual symptom. But this is just things to look out for. So first of all, weight loss. And this can be rapid, it can be gradual weight loss. And sometimes also it can be hidden, because if a young person is wearing a lot of baggy clothes, sometimes we don't see. And I've spoken to parents where actually the weight loss has been found quite late, because they might only have seen how much weight their daughter has lost because they've accidentally seen her getting changed and then been really shocked by the amount of weight that she's lost. So it's just being aware of, like, have I actually seen her body recently, or is it always being hidden under baggy clothes so you can't see? Amenorrhea, that's the loss of periods or irregular periods. So that's something that we look out for. Dizzy spells, feeling faint. Often you might notice that if somebody sort of gets up from sitting, and you're noticing that that's happening quite a lot. This is due to low blood pressure. So we know with anorexia, it can lead to loss of muscle mass. So if somebody's lost, a lot of weight and is significantly underweight, it affects muscle mass. And of course, the heart's a muscle, and the muscles of the heart can weaken, and that can lead to an overall drop in blood pressure. So that's something why we're looking for that. Chest pains, again, anorexia and bulimia can affect heart function, and so chest pains we always ask about. But also, if somebody's making themselves sick very frequently, then actually that can cause strain to the chest muscles, so you can sometimes notice pain. Again, muscle weakness, which because general, just low weight, frequent, vomiting, and maybe over-exercising can lead to that. This abdominal pains can often be experienced after eating. If someone's been restricting their food for a really long period of time, the stomach shrinks and the gut slows down. So that means the food sits in the stomach for much longer, and that can cause quite a lot of bloating. Now, somebody with anorexia is going to misinterpret that and think that means that they've eaten too much, when actually it's not. But that's something else just to look out for. Constipation, that again relates to that above point, about the gut slowing down. Feeling cold, understandable, if there's a drop in core temperature of the body, and that's made much worse if there's less body fat and less insulation. That dry skin can be due to dehydration, feeling very fatigued, just lack of energy because of starvation, low weight, over-exercising. Disrupted sleep, that's a common problem we can see. Now, obviously, disrupted sleep can be caused by all sorts of things, not just like an eating disorder. But in terms of an eating disorder, if somebody's really underweight, a hungry body just won't sleep normally, because the body's prime driver is to keep the body awake, alert, and trying to get food. Bloodshot eyes, calluses on fingers, swollen glands on the face, that is what we would see in somebody who is frequently making themselves sick. So that's just why I put that there. And understandably, with all of these symptoms, if you're, a coach, you're going to be noticing a real deterioration in athletic performance. Okay, so eating behaviours, got lots of things to think about here. So things you might notice: somebody skipping meals, hiding food, lying about what she's eaten, saying that they've eaten when they haven't, maybe making excuses for not eating, perhaps being quite secretive, excessively focused on healthy eating, so that sort of suddenly now never eating food that they think are bad or unhealthy. A very restrictive vegetarian or vegan diet. Now, when I say that, lots and lots of people these days are moving more towards plant-based diet, vegetarian, vegan diet. What we know is that there is a much, much larger proportion of vegans amongst young people with eating disorders than in the general population. That doesn't mean that having a vegan diet puts you at greater risk, of course, of having an eating disorder, but choosing to be vegan can be a really easy way to cut out major food groups. So it's an easy way to get rid of meat and dairy without people questioning too much. So all I ever say to people is just be aware of when did somebody decide to become vegan, and did it happen at the same time as some of all these other things that we're talking about tonight. That's all I think is quite useful to think about. So that's about avoiding or cutting out foods that people previously enjoyed. I often see carbohydrates seems to be the main thing that's being cut out these days, but it also tends to be high sugar foods, high fat foods. Counting calories, checking food labels, preparing all her own food and not wanting to eat food that's cooked by others, even parents, and then suddenly being quite rigid around that. Wanting to be involved in cooking. I often find parents are saying to me that somebody's always hovering around them, checking, asking questions, or reading recipes. And another one is baking, doing lots and lots of baking, but never eating what they bake, wanting everyone else to eat it. Questioning what's in the food. So, checking what's in it, how much oil is being put into it, saying that that's too much oil that you've put in, and trying to negotiate a lot around it. Perhaps eating on her own or avoiding eating with other people can be another thing that you might notice. Checking what other people are eating. You might notice that she's asking more about what other people are eating, or comparing what she's eating to other people, or only eating if other people are. Eating very slowly. So eating habits change drastically with an eating disorder. So some eating can become really obsessional and what I would say really ritualized. So people eat really slowly, might be the last to start and the first and the last to finish. And there are lots of rituals around food. So people talk about, cutting food into tiny pieces, using specific cutlery, eating in a certain order. And the other thing to look out for is somebody's constantly going to the loo. So during meals or spending a long time in the bathroom after meals, because you're wondering if they're trying to compensate for what they've eaten. So other behaviours that we would be looking out for are body checking. So we know one of the symptoms is this sort of distorted body image, and being really concerned about how they look. So this means then that people often feel really compelled to check their body to see if it's changed, to see if they can feel fat. And this is often worse after eating, when they're often feeling really, really guilty about what they've eaten. So you might notice they're checking their body a lot in the mirror, or they're trying to measure their arm, or they're trying to pinch their skin to see if they can feel fat. For some people, they might be wearing baggy clothes a lot more, maybe to try and avoid seeing their bodies or trying to hide their bodies from other people. Weighing herself frequently, excessive and compulsive exercise. Now with this, I would just ask that people the things that people probably should be looking out for and asking themselves: is she doing more exercise or training than usual? Is she being secretive about what exercise she's doing? Sometimes is she exercising secretly in her bedroom? Is she doing lots of individual workouts that she wasn't doing before? Is she doing a lot more than her coach would expect her to be doing? Or you might find she's trying to involve other people. She might constantly be asking you to be doing exercise with her, or to go out and do exercise. Is she exercising even if she feels tired or unwell or has an injury? Sometimes you need to look at, there's lots and lots of rigid rules around it. Does she feel that she has to do, a certain set number of exercises a day, a certain number of star jumps, a certain number of sit-ups? Or is she counting steps? Now we have smartphones and Fitbits, and to be honest, I think in some ways they're good, but in some ways it means that it's constant checking. Am I doing enough steps? Should I try and make it? That means then tomorrow I need to do more steps. So it's constantly trying to increase what you're doing. Pacing, feeling restless, around meals, that's something we often notice. And also it's following food, weight loss or fitness sites on social media. So I know it's not unusual for teenagers to spend a lot of time on social media. I have I have 3 children. I have two teenage daughters and I have a 12-year-old son. And so I'm fully aware that they're going to spend a lot of time on social media. And you know what, that's okay. There's lots of benefits, I think, to social media. I think it's just looking at how much time they're spending on certain sites, because also the more that they follow these food and weight loss sites, then these sites are constantly popping up on their pages. And that's the problem. Then they're reminded of it all of the time, and that keeps them really, really preoccupied with it. Some of the psychological signs that we might be looking out for: emotional changes. So low mood, irritability, angry outbursts, anxiety. You could look at all of that and think, well, that seems, again, that's really normal for teenagers to have lots of emotional changes. But I think, again, we're looking at it in the context of all these other changes that we might be seeing as well. Anxiety around meal times, seeming really stressed, worried, lots of questions that they're asking. Persistent worry or complaining about being fat, or saying she wants to lose weight, or comparing herself to others. The obsessional behaviours, like I said before, about lots of the way they're eating actually at meal times, and the type of behaviours that they're doing, taking really small mouthfuls. And rigid thinking. So that means finding it really difficult to compromise and have a change. So it might be that the meals changed, and they might find that really difficult because they thought they were having something else. And again, that's something that you might need to look out for. And again, wanting this routine, needing sameness and predictability, and also problems concentrating, because you can imagine if you're not eating enough and you're it's going to be really hard for you to focus and concentrate on schoolwork as normal. And unfortunately, I think there's something we really see a lot of is when people become really withdrawn socially. That you might find that they're suddenly less interested in seeing their friends, not wanting to do their normal hobbies. I know at the minute in lockdown, everything's 100 times more difficult because they can't do that anyway. But I mean, even just losing any interest in other people or the outside world, because their whole world is about controlling food and weight and exercise. So what can you do? I'm very aware that it's 2:15, so I'm just going to literally whiz through this last slide, and so we've got time for questions. But one of the slides I'm not actually going to do tonight, because I think
Please don't worry, Susie. Take your time. It's fine. Everybody's very engaged. It's absolutely fine.
So what can you do? So first of all, I would be saying, for anyone who is concerned that maybe something's changing, that maybe they're seeing this disordered eating, or maybe they really think that their young person, their child, or somebody that they know of has an eating disorder, it's really important to start the conversation and to share your feelings, share your concerns, and find out how they're feeling. And young people can respond in different ways. For some people I've spoken to, it's a huge relief, and it's such a relief to say that there's a problem. And for some people, they're going to deny it completely and say that everyone else has got the problem and it's not them. But what I would say is it's your responsibility as the adults to make the decision about what needs to happen next, even if she's saying it's not a problem, but you really, really think it is. The second thing is about, I suppose, just keeping an eye on things, really, monitoring and supervising. If you think that you've caught the changes early and that you don't think that there's any significant risk, then often you can make the changes at home early on. You can intervene early and get things back on track, and you don't need any additional support. And by that, I mean keeping an eye on things, talking about what healthy eating is, talking about what healthy exercise is, correcting those misperceptions. So if they're talking about and you think their attitudes sound quite abnormal, sort of, beliefs about food, it's correcting them. And talking about the risks of unhealthy eating choices, and really helping them to re-establish healthy eating habits. That's really what you're trying to do. Eat regularly, feed your body, and it's all, it's a balanced, healthy diet. The third thing is about sharing concerns with other people, basically talking to other people, anyone else involved with your young person, whether that's sports coaches, teachers, anyone, like other relatives who have a lot to do with your young person. Because if there are concerns, then you can agree a plan, and it's just getting other people's points of view. But for example, if there were concerns that somebody had lost a lot of weight and you were really concerned about the amount of exercise they were doing, a parent might talk to the coach and just say, I think we need to stop exercise until we've sought professional advice because we're too worried about the risks. The 3 C's, I always, when I'm talking about communicating with young people and we're thinking about whether they've got an eating disorder, I always just like these because it's simple to remember. And it's about being consistent, and it's about being compassionate, and it's about being calm. And consistent, by that I mean that it's important for parents to make joint decisions about eating, about exercise, about being on the same page, and having really clear boundaries about what she can do and what she can't do to keep her healthy. And although she might respond feeling really angry, it's really important to be consistent, because in a way that's being very boundaried and helping her to feel safe in the long run. Being compassionate, and by that I suppose I mean it's absolutely fine and important to commiserate with how she's feeling, to commiserate with the fact that she's feeling really scared and angry and sad and hating what this eating disorder is telling her what to do, a lot of conflicting thoughts, which can be really overwhelming. But it's really important to listen whilst at the same time sort of holding her distress and tolerating it without always having to try and do anything about it. I think often as parents, we want to take that pain away, but part of recovery and part of getting better is about sitting with that pain, sitting with those difficult feelings. And if she can see that you can tolerate it, it's a really strong message that she can tolerate it as well. Because we can't prevent pain, and we can't prevent and try and shut out all these difficult feelings. We have to manage them. And again, about being calm, this isn't always easy. I mean, there's going to be times we can't always get it right, and we're feeling really, really overwhelmed. And it can be really overwhelming for parents and for anyone involved. So you have to look after yourself too. But seek advice if you're worried and if you're struggling too. I put intervening early, and the reason I did that because I've worked with so many families where they've delayed seeking help because they think that the behaviours they were noticing, they put them down to normal adolescent behaviours. For example, somebody who was suddenly started preparing all their own meals or started skipping meals and sort of not eating that regularly. And of course, as young adults, people are becoming more independent and they take on more responsibility, and that's absolutely fine, and that's something that we encourage. And making an odd meal for themselves isn't unusual, and getting angry isn't unusual, But what is unusual is if they have to cook every single meal for themselves and they become really angry or upset if you suggest cooking for them. So all I say to people is reflect on how they're responding. So if you were to say to somebody, well, how, you know, I'm going to cook this tonight, and look at their response and just ask yourself, does this feel right to me? And go with what your gut feeling is, because I think generally we know if it doesn't feel right. And the last thing, of course, is seeking professional advice. And if you are worried, we know it's important to intervene. We know there are lots of risks. So if you are at all worried, you can go to your GP, you can, you know, refer yourselves directly to eating disorder services and just speak to somebody if you're worried. Now, I'm not going to deal with this slide right now because that's just general stuff. I'm going to finish now, but this was something that just some really useful resources. If anyone wants to read more about eating disorders, BEAT is the leading UK charity for eating disorders, and it has fantastic resources, information, but it also has support groups. So I always direct people to BEAT. UK Sport has a great document all about eating disorders in sport, which has so much information about what to look out for and what to do. And Young Minds is a fantastic website that looks at all different mental health issues for young people. And again, has so many resources. So that's something, if you do want to be directed anywhere, these would be the places that I'd recommend. And thank you, and that's it.
That was so good, Susie. Thank you very much.
I'm really sorry I went over it. I find it really hard to try and cover everything.
No, it was so clear and engaging. I think everybody was kind of hooked on every word that you were saying. One of the things that really struck me was just how complex it is, because things like when you were saying about girls wanting to exercise on their own, we also know that a barrier for girls with exercise and activity is the feeling of being watched. So, you know, they might want to exercise on their own in their room, and it doesn't necessarily mean that they've got an eating disorder, but at the same time, it could be a red flag. So, I mean, and that's just one example that came to mind, but, you know, throughout I was thinking this is really, really complicated for parents to be able to look at their child and, as you said, think, is this just normal adolescent behavior or is there more to it? So thank you very much. And I know that we've got lots of questions. Jo, do you want to get started?
Yes.
Have a look through as well.
Yeah, just following on from what you just said, Caroline, isn't it so important for parents and caregivers like to follow their gut? You know, when you know something doesn't seem right, you do something about it. So yeah, let's dive into some of the questions. So first off, I'm wondering what Susie's thoughts are on the problematic nature of sponsorship in sport and how girls can get over these pressures. I imagine they do feel a lot of pressure to perform if they're being sponsored by a big brand.
Yeah, I think that's it, and I think it's so always looking at I suppose the support they have around them, and I think when one of the slides I didn't cover today was really looking at general recommendations, and I suppose with things like, you know, we're thinking about things like sponsorship, that there are those pressures, but I think when you've got that support network around you and you've got coaches who are trying to focus more on sort of person orientated motivators rather than just performance orientated, so it's really trying to think about the positive things, and that is difficult, but for some people they manage that and the sponsorship is a real driver, and that really inspires them and they're not going to have any problems. I do think with all of these it's for some people who already have a vulnerability, and it's then really when you're looking at all the other signs. So a bit like you were saying, Caroline, if you're exercising on your own, the problem is if you're exercising on your own and then you've got all these other signs as well. But yeah, it is a tricky one with sponsorship.
Yeah.
And I would say actually for that one as well, you've also got to hope that the structure that's in place around that sport has got some responsible adults who are not putting the pressure on. You know, I know that we've seen in gymnastics recently that there's been scandal around pressure there. But you've just got to hope, and I know we've got some coaches and teachers on tonight, that you can be that responsible adult and sort of put to one side maybe performance, although performance is important, especially if somebody's on a career pathway, but just think about the other side of it, which hopefully tonight we've educated people about.
Yeah, definitely keeping those lines of communication open,
Yeah.
and letting the coaches set realistic expectations and boundaries to really support that athlete. Susie, do you know if there are any links between ADHD, autistic spectrum disorders, and eating disorders? Interesting question.
Good. Yeah, very good question. We do know that with autism spectrum disorders, there is, when we think about eating disorders, we tend to see quite a high comorbidity. So quite a lot of people with eating disorders also have autism or OCD, obsessional compulsive disorder. I'm not aware so much of ADHD, so that wouldn't be, but autism certainly, that there is a sort of higher rate amongst people with autism.
Great, thank you. Are there any resources that you would recommend, such as posters or printouts, that one of our attendees tonight can maybe put in a training hall and remind some of the girls about eating healthy habits? I think that's a brilliant idea.
Fantastic. Yeah, so I think in terms of a good place, as I said, would always be is look at like BEAT for sort of like, I suppose when it's thinking about healthy eating and sort of thinking about what healthy eating and exercise is. So I would direct people to BEAT for that.
That sounds great. This is one of my own questions, actually. I was just adding it to my own chat. I was just thinking it must be difficult to encourage a daughter to come to the GP with you. And I was just thinking about this, if you follow your gut and you know that there's a problem, and then you may potentially have a daughter that's in denial, how do you take the first steps to maybe have that empathy and try and encourage them to see a specialist?
Yeah, it's a really tricky one. And I suppose that goes back to those 3 C's I was talking about. And in terms of being that sort of compassionate, it's sort of saying, I suppose it's saying, I'm wondering. It's saying, I've noticed this. This is what I've noticed. This is what I'm wondering. I'm wondering if you're feeling a bit more anxious about it. And as I said, some may respond by saying, actually, yes, I do feel that way. I think so for those young people who are saying, yes, I think there's a problem, I think it's quite easy to take the next steps to go to the GP and speak to somebody about it. The problem, I think, is for those people who are saying, no, there's really, really not a problem, and really sort of resisting going. And I think then it's about being quite clear about saying, well, I've noticed this and I'm wondering this, and I think we should just go to find out a little bit more information. So that you're still being consistent and firm and boundaried about it, but whilst also understanding that they're going to be anxious. And also they're going to be anxious if, just to speak to somebody they don't know. But I'm hoping that, once they're there, they're a little bit more reassured.
Yeah, no, you're right. We have to be try to be firm as the grown-up, really, as the parent. It's, as you say, it's so hard when you see them in pain. You do feel it, don't you, literally? And that leads me on to the next question, because somebody's just asked, is the GP the first step, or can you sometimes potentially just go straight to a specialist? Is that a personal choice?
So you can either go through, so for the NHS eating disorder services, you can either go sort of directly through the GP, or you can self-refer as well. So you can do either for that. And also with NHS services, you can also ring services, if you're really worried about making a referral, they're also sort of duty clinicians, and you can always speak to somebody to get some advice about whether you should refer and what you should do.
Okay, now that's excellent. Can you offer any advice as to how we might support a young adult who's just starting the group therapy stage via GP referrals? So what's the advice for someone at that stage?
Sorry, who's just started group therapy?
A young adult who's just started group therapy stage, I'm assuming for an eating disorder. How can that person maybe support that young adult at that stage?
So I suppose it depends so that I suppose with that question, I'm just wondering, because group therapy is something you might have treatment for under 18s is generally sort of family-based treatment. There can be groups for things like bulimia nervosa, which, as you say, for young adults. And I suppose it's just finding out what support they feel that they do need, because everyone's different, really.
Yeah.
And it may be that, you know, they do need that extra support around meal times, and for whatever, you know, with bulimia, if they are having group therapy, they're going to need a lot of support after meals when they've got those real urges, you know, to act on the thoughts. So I suppose it's just speaking to them and finding out what support they need.
Yeah, that's really good, just to see to them, what can we do to support you? Yeah, and I think that's great. This is a good question. Do you think that social media influencers are having a negative impact on our young people and encouraging us to, you know, obviously you've got realistic body images or unrealistic body images, promoting quick fixes, you know, could that be having an impact on the rise of eating disorders? It's difficult, isn't it? Because as we said earlier, social media, it can be such a fantastic place, like what we're trying to do with promoting so much positivity of women in sport and body image, but equally there's a lot out there that doesn't.
Yeah, and I think you're right. And I think I'm just thinking of the positives. You know, there's work with a lot of young people and teenagers, and there's so many body positivity sites. So that, you know, there are some really positive things. But yes, I don't think we can deny that social media can be unhelpful. I think it depends, though, on what sites you're looking at, how long you're looking at it for, and I think, you know, the sort of pro-anorexia websites can be incredibly harmful and damaging. But again, and I think we even have these sort of recovery websites, which, you know, some people might argue are helpful, but equally it's keeping somebody constantly comparing what they're eating to other people. So I think, yes, I think social media does have its advantages, but certainly does have its disadvantages. And I suppose it's just about having, with anything, it's everything in moderation and a balance. So I always say to young people, I'm never expecting you to stop using social media. But if somebody is really looking at too many fitness or food-related sort of sites, it's saying, have that balance. Make sure that you look at those people where it's more about, you know, like people that you really admire, whether it is sort of like sports people or comedians or people, there's something where it's not just about how they look and how thin they are and all about appearance related things.
So in our very first talk, Susie, we talked about confidence, and Jo was one of the speakers, but we also had some ladies on from Wales who are called the How People, and they're very interested in teenage girls and their development. And one of their top tips to take away was to, as they coined it, to control the scroll. So it was encouraging parents to maybe periodically, you know, have a look, sit down with their daughter and have a look at the phone and have a look at what they're looking at and saying, is this actually making you feel good? Why not just declutter and sort of start to unfollow some of these people that are really making you not feel good about yourself, because, you know, in the long term, it's not going to be helpful. So nice link back there to our first talk. And yeah, parents and coaches and teachers, think about encouraging control the scroll.
That is such a good point.
It's such a good point. I think I'm gonna hold on to that now too.
I love control the scroll. And I wrote this down, Caroline and I, we were in sync tonight. So a couple of things I wrote down from before was, you know, if the parent or the caregiver says to their daughter, when they look at that account, how does it make them feel? Why are they following that person? Does it spark joy? And actually, yeah, they're in control. We control what we see. And if it doesn't make us feel good, you know, unfollow.
And I think also it's just thinking about so many people, it becomes all about the number of likes, or, you know, and there's also a lot of things we talk about now about fear of missing out. But again, you sometimes saying, do you want to look back later on and think, is that what was the most important thing to you, was to think how many likes you had? Or is it more about, I work with lots of people about values. So even, I'm thinking that works really well at that age group. Think, what is important to you? So what are the things that are really important to you as a person? And I think you're really trying to hold on to that. To think, so I know we can't deny that body image is a really big aspect of the world that we live in, but there's so many other important aspects too.
Yeah. I had such an interesting conversation with a lady I know called Molly Gunn. She's got 100,000 followers. and she wrote a piece. I'll have to try and dig it out for Caroline, but it's the first time I've ever seen it. Her main goal for 2021 is to like half her number of followers. She wants to reduce, and it's all about that quality and the engagement that she's having with her followers, because she doesn't, she wants to sort of not know who they are, but she just wants to feel like she's really engaged. So her biggest goal is to like reduce followers. I was like, I've never heard that. That's so good. Right, I'll crack on with some more questions. So can we have some advice, please? Some advice says avoid talking about food. That it's quite true, isn't it? However, the two young adults that this guy coaches or has coached for previously found it helpful to actually get to the point, maybe, and discuss the elephant in the room, I would imagine, to discuss the issue whilst they're recovering. What are your thoughts on, discussing the topic of food?
Yeah, well, I mean, I suppose if somebody's got an eating disorder, what we always say is at meal times, I'd be saying don't talk about food. So I think there's times when it's just going to make the situation worse, and what you're trying to do is focus on anything else that's happened in that day and not focus on food. But more generally, as a point, I think we do need to talk about food in terms of what is healthy eating. So we're trying to, and that was actually in that slide that I skimmed past quite quickly, was about what messages we need to give our kids, which is about eating normal balanced food where there are no inherently bad foods, because I think these days there's so many messages about what we should eat. I talk about it really is having everyday foods and having occasional foods, but what we also need to bear in mind is that we need to practice what we preach. So if we're saying to our kids that we need to have body sort of positive, messages, and we need to be able to, generally eat healthily, but you have to have those sort of occasional foods as well. But then they hear you saying, oh, I should, I'm not going to have that because I'm being good, and oh, I ate so much yesterday and I feel so bad. They're going to be confused. And so I think it's really important to give those really clear, positive messages, not only about healthy eating, but about helping young people to value their bodies no matter what shape or size they are.
Yeah, role modelling is so important, and it's something that we talk about a lot actually at We Are Girls in Sport with regard to exercise, as in if parents are exercising, children are more likely to get involved. But I think it's also true with regard to food and how we talk about food. And I know parents that are on here tonight, there's an awful lot going on at the moment. So to then start role modelling about food is maybe just another thing. But maybe, maybe let's just try not to talk about it so much. It's hard for parents to be perfect.
When I say that, Caroline, absolutely, I'm a parent, and the other important thing is we're not. No one's perfect, and we all have our bad days, and we all have those days where I do it all the time, where you're thinking, I really shouldn't have said that. That was the worst thing to say. But we're human, so we have to be kind to ourselves. It's more as a general message that we're trying to aim for.
Totally agree.
One last question, and then we've had actually a couple of last questions. So, Susie, how do you differentiate between someone just wanting to lose weight and them actually having an eating disorder?
Yeah, that's a really good question. And I think it depends on what their weight is. So if somebody is, if their weight is within the healthy range and it seems okay, that it's when you're looking at somebody who wants to lose weight, but then it continues. And I think that's when you want to try and nip things in the bud early, and you want to try and intervene early, because what we know is that if you start to lose weight, and you lose weight quite quickly, and the eating disorder, sort of that type of thinking, sort of starts to develop, and they want to lose more weight, and they want to get to the target weights gets lower and lower, things can spiral really, really quickly. So I think it's always keeping an eye on things. But we can't deny that some people, they might be at a weight where they do want to lose a little bit of weight. And you're just looking at generally, I suppose it's again thinking, well, is it generally a healthy diet, but are they still eating regularly? Are they still able to eat the occasional food, like eating treat foods, going out and having a takeaway, having chocolate occasionally, having a day off exercise if they're really, really tired, all that sort of thing. It's just looking generally are they doing it in a healthy way?
Yeah, no, thank you, Dr. Susie. Yeah, it's been absolutely brilliant. Well, just want to say a big thank you from me and also to everyone that has attended tonight. I'm just going to hand back to lovely Caroline so she can wrap up and say thank you as well.
Can everybody just go back on mute for a second, please? Suddenly got lots of voices.
Today, that there is a possibility that households may be able to meet up on.
Phew, right, found it in the end. Wasn't quite sure what we were going to hear there. Yes, so thank you very much. What I've learned tonight is that it's really complicated, and that there's much more to it than meets the eye, and really you've got to look at the whole package. As Joe said, follow your gut, but there's a lot more to it than just somebody who's trying to lose weight or somebody who has disturbed sleep. You know, there's quite a lot to take into account, but communication is key. So thank you very much, Susie. So pleased that you could share your experience and knowledge with us. And thank you very much to everybody who has come this evening and has been part of our Wellness Month. Joe and I have been absolutely blown away by the support that we've had and just the number of people that have been interested. There'll be a survey coming out tomorrow about tonight, but some of the feedback that we've had so far, thank you very much for completing those surveys, and the feedback has been really astounding. So watch this space for some more bits and bobs that Joe and I are going to do. We're going to, throughout February, just start developing and working on the feedback that you've given us, because it's clear that there's demand for information on these topics. And yeah, it's just been a really, really great month. So thank you very much to everybody who's signed up, everybody who's fed back to us, to all of our speakers. They've all been fantastic. Thank you to Joe for being there for all of them. And yeah, just watch this space. Follow us on social media to see what we're going to do next. We've got a newsletter coming out starting this year as well. So you'll hear more about what we're doing in that. So thank you very much, and good night.
Good night. Thank you.